British Association for Immediate Care, Wikipedia article audio. The British Association for Immediate Care is a registered charity which aims to encourage and aid the formation and extension of immediate care schemes and strengthen and develop cooperation between schemes providing immediate care and the statutory emergency services. The organization relies on volunteer medical professionals and allied health professionals to provide immediate health care assistance in support of the emergency services. It is based in Ipswich. BASICS is an association of healthcare professionals, who undertake additional training as immediate care practitioners. The members provide their services in support of the statutory or voluntary ambulance services. Purpose: local applications. BASICS aims to be. BASICS provide a member of the GERCalc members section to aid in the development of clinical guidelines for UK paramedics and EMTs. BASICS members are used to provide extra skills at the scene of major incidents, or for particularly difficult patients. For this, individuals may be summoned on a case-by-case basis by the local ambulance control centre. Further support for the work of BASICS during major incidents came following the July 7 terrorist attacks on London, when the British Medical Association started a series of training courses to be organised by BASICS. They also work at private events, often alongside the voluntary ambulance services or the statutory service. This means that BASICS members can be found at events such as BASICS assist the ambulance service trusts where a multi-agency response is required at a local level, or additional skills and qualification levels are required. An example of this multi-agency response would be seen at an industrial accident where, for example, a worker has become trapped in machinery. The ambulance service would work alongside the fire service to coordinate the rescue. BASICS can supplement the skill set available at scene with a medical doctor, who can provide skills outside the remit of paramedics, such as different methods of providing analgesia and, if necessary, surgical procedures which might be needed to extricate the patient. Local schemes. BASICS affiliated schemes across the UK include: many of the UK air ambulance organisations are affiliated to BASICS. Staffing. BASICS started up as a small number of general practitioners who were concerned about the immediate care that car crash victims were receiving. Their goal was to bring increased clinical expertise to the scene on a voluntary basis. Now BASICS doctors come from a wide range of specialties, including general practice, surgery, medicine, emergency medicine, anesthesia and critical care. Nurses who specialize in pre-hospital care play an important in the delivery of patient care in the pre-hospital arena. Some nurses working in pre-hospital care are able to work at advanced nurse practitioner level with a high degrees of clinical autonomy and decision-making. Some are also independent prescribers. Being the primary pre-hospital medical care provider in the UK, paramedics are a valued part of BASICS schemes. Many have undertaken additional training and education to become critical care paramedics with an extended range of pharmacology and potentially life-saving interventions to complement those of their colleagues. Some paramedics respond autonomously under BASICS schemes, whilst others respond in paramedic/doctor teams. Doctors. Combat medical technicians are also welcome members of BASICS and bring a high degree of knowledge and experience to BASICS. Nurses. Paramedics. Combat medical technicians. Large sporting events, major incidents, public rallies, road traffic collisions, mass gathering events, concerts. Lincolnshire Integrated Voluntary Emergency Service, MAGBAS, Suffolk Accident Rescue Service, Med Alert, Swift Medics Wiltshire, Mercia Accident Rescue Service, West Midlands Care Team.